Today I'm going to show you how to do a sciatic nerve glide if you're having any nerve pain that goes from your buttocks down your leg. Hey, before we get into the video, I'm Dr. Jake Easy, physical therapist and certified personal trainer. I help people that are experiencing back pain get back to the trail pain-free and do their next adventure without any fear of experiencing back pain. So if that's you, please go ahead, check the comment section below. There's going to be a free guide to getting rid of your back pain, as well as a link so that you can talk to me one-on-one. And that's called my free body diagnostic, where we can help you stay pain-free, give you the right path to whatever goals you may have. This is the supine sciatic nerve glide. You do this by laying down on the floor, your bed, any flat surface. Head's going to be down, and then you can usually have a pillow underneath your head here. You're going to lift up one of your legs, and we're just going to get that hip up to 90 degrees, kick it straight, and then we're going to pull up our toes. You may feel more numbness and tingling there, then you're just going to bring it back down. So what I want you to do is you're going to hold your leg here like so with your hands, or you can use a band around your thigh, just something to grab onto, hold it there, kick it up, and then you're going to pull those toes down. So you go until you feel that pull. Maybe you'll feel numbness tingling. That's okay. That's actually usually a good sign. And then you're going to back it off. So you're just flossing this back and forth. Okay. If this hurts your low back, you can put something underneath your low back, like a towel roll, hand towel, something small right in the arch of your back. Start slow with these, but progress your way up to doing 10 repetitions 2 to 3 times per day. Once this feels like you're not really getting any numbness and tingling, or it's not severe pain anymore, then you can start progressing the exercise. So then you're just going to start going to the side. So you can do that, and you can do the other one as well, like this, where you have a bed sheet, a band. It's just something to hold on to, and you're just going to go across your body now. Head stays down. If you put your head forward, you may have an increase in symptoms. This is because you're putting more tension on the sciatic nerve. So keep that head back best you can, and you can have it on a pillow, but try to have it on a thin pillow. Next, we have sciatic nerve glide number 2. You can do this sitting. You can do it on a bench, chair, doesn't matter. You just need to be sitting, and the position that we're going to start with is actually the way we assess for nerve pain. So first, you sit in your chair. You're just going to take your hands, put them at your sides, or put them behind your back. Ideally, behind your back, if possible. Next, which you're just going to slump with your worst posture. Head down, shoulders rounded forward, and just kind of round your back. Some people may experience symptoms here already. Next step, find your non-symptomatic leg. So if your right leg hurts you, start with the other one first. Then you're going to kick that leg out, pull your toes up, keep your head down, slump with your worst posture. You may feel this going up your leg. Notice what symptoms it is. Is it numbness, tingling, pain? Does it just feel tight? Keep track of that. All right, so this should be, like I said, your good leg. So you can compare that to your other side. Now, what I want you to do is pull up your toes so extend your knee, pull up your toes. Then once you're in that position, lift up your head. Does it feel any different? Put your head back down. Does it feel any different? If it feels different with your head down, so if it hurts more in your head down, it may be sciatic nerve decreased mobility there and just some nerve pain. If you lift up your head and it feels better, once again, it may also be signaling that you have some nerve pain. Not always, but sometimes. So then you go ahead and do it on your painful side. So once again, hands on the sides of you or behind your back, head down, kick up, pull the toes up, and then lift your head up. Is there a change or not? And record. Okay? So you can write these down. That usually helps you determine how you felt between each leg so that you don't forget. Okay, I'm going to show you kind of facing sideways. Ideally, you wouldn't do this, but just so the camera can see a little better. So what you're going to do here is, this is how you would floss. We call this, like, the test you just did was a slump test. This is like nerve flossing, and you can do this sitting. It's very similar to the one that you did laying down, but this is usually more comfortable for people that have a lot of back pain, and like maybe you have back pain when you lay down. So this is a good option for you to start and then progress to the other one, the first one, once your symptoms are reducing a little bit. So what you do, hands behind your back or hands at your sides, whichever you need to do. You're just going to do that same motion. So you're just going to keep your head down around your shoulders, kick this up, pull up your toes. Then I want you to lift your head, put your head back down, put your foot, point your toes now, and then bend your knee. So I'll show you here with this leg. So kick it out, pull the toes up, lift your head, put your head back down, point your toes, bring it back down. So it's always lift, and then you just do ankle, head, head, ankle, bend. So bend, ankle, head, head, ankle, and then bend. You do that the same with the other one 10 times. You go to that slight discomfort, and you don't have to push with this one. If you push, you're going to flare yourself up. Nerve pain is very sensitive, and if you flare it up, you're gonna know. So go very sensitive. Start with 10. If you can't even tolerate 10, go down to 5, go down to 3, whatever you can tolerate. But start with 10 usually, and then progress your way up to 2 to 3 times per day with this. So like I said, the sitting one is usually more comfortable for people than doing the laying down exercise. Okay, I'm going to show you a third exercise that you can do if you have any sort of sciatic nerve pain. You start by laying down on the floor. You can also do this sitting, like at your desk, a chair. You take your foot, you start, the easiest is down at the ankle. The higher you go, the harder it is. So start down here, you're just letting that hip kind of fall open. So you're going to try to find a spot where you feel a slight pull or stretch. Then you're just going to apply some pressure to your thigh. You're trying to push that knee down to the ground. You hold that stretch 15 to 30 seconds, and you want to do a total stretching time of 1 to 2 minutes. This is a bonus stretch. If I want to stretch my right leg, you're going to use your left leg, bend it, put the other leg crossed. Now, you're going to pull that leg up, and you will feel it in the leg that is up and around your other thigh. So I feel this right now in my right leg, and I feel it in my buttock. So I'll show you around. I'll flip it around. Like I said, knee goes bent. Bring it up and over the top. Grab hands under the thigh. Pull up, and you should feel this kind of right here, all up in here. You can also use a bed sheet, a band wrapped around your thigh so that you don't have to reach so far. You can also just kind of hold on to the band like here if it's wrapped around your thigh and you're just pulling it up. Once again, hold it for 15 to 30 seconds. You're going to do a total stretching time of 1 to 2 minutes. And ideally, you would try to break this up maybe throughout the day. All right, guys, I hope this was really helpful for you. I gave you some examples of how to stretch out your piriformis, how to stretch out your hip into external rotation, and how 2 different ways to do your sciatic nerve glide. I hope that gives you some insight on what you should do and what to look for. If you are experiencing any pain, please comment below what you're going through. If these stretches helped you, I would love, if you want to reach out to me, you can click in the comment section. There'll be a link for a one-on-one schedule that will have you fill out a form, and then I will get in touch with you through email, and we'll go from there, figure out what you need. Once again, I have my free ebook. This is on how to reduce your low back pain in 5 simple, easy steps. So go ahead and check that out. It has a analysis section where we're putting you through some motions. Then after that, it'll give you specific exercises that are tailored to you and your specific condition. So I hope that was really helpful. Like I said, please comment, like, and subscribe, and ring the bell for the notifications. It helps out tremendously. And share the video if you found that this was really helpful. So as always, stay pain-free on the trail. Keep doing your adventures. And if you're looking for something more specific, if you want to get rid of your back pain today, then I highly recommend that you reach out to me. So as always, you guys have a great day. I'll see you on the next one. Take care.